Ray Joyce. McLaughlin. Baston is excused. Peto. Here. Miller.
Present.
Robinson.
Here.
Lane.
Here.
Collins.
Here.
And Lockhart.
Here.
You have a quorum.
Thank you, Rebecca. So welcome to the February meeting of the Albany County Legislature's Health Committee. Most items tonight are on the Department of Mental Health. But first, under previous business, under number one, can we get a motion to approve the previous meeting minutes? Motion made by Ms. Peto, second by Mr. Miller. All in favor?
Aye.
Any opposed? Unanimous. Number 2 and 3, I understand are being tabled at the request of the sponsor. Is that correct?
Yes.
Okay. So moving on to current business. Number 4, authorizing an agreement with Psychiatric Group of Albany regarding psychiatric services. So tonight we have Dr. Giordano.
Good evening, Mr. Chairman.
Good evening, how are you?
I think you all know my senior team. This is Deputy Director Hoffman and Associate Director Fitzgerald, fiscal, everything else. Thank you very much. So the first item is the PGA contract, did you say?
Correct, yep.
So the Psychiatric Group of Albany has been our medical provider for probably 20 years. And this is a new 3-year contract that we're entering into with them. It's in the sum of $1,988,439. A couple of things about this contract I think is worth mentioning. There are 7 medical providers, 4 psychiatrists, 3 nurse practitioners. They serve our clinic, which runs from 600 to 700 patients. They provide 150 hours a week of service at the clinic. They serve our Certified Community Treatment Team, which is, I think, 19 hours a week. Our AOT program, which is Assisted Outpatient Treatment. You may have heard myself or the county talk about this. This is one of the unfunded mandates that our county has to respond to. We have 90 cases in that program, and our psychiatrists work in that. I think the only other thing that's important to tell you is that most of, or much of the services that they provide us are reimbursable. We monitor the return on investment with each of the providers and the group as a whole. There are some of these providers that are doing face-to-face clinical work as their main responsibility, and their return, reimbursement return is upwards of 80, 85, sometimes 90%. As a group, because we have a high no-show rate, given the population we serve, and the fact that some of the services they provide are not reimbursable, we're recouping on average about 65, in a good year, 70% through reimbursement. So we ask that you consider approving this 3-year contract.
Thank you, Dr. Giordano. Do we have any questions from the committee? Hearing none. Oh, Carolyn McLaughlin's here. Oh, Ms. Lockhart?
I'm assuming reimbursable through Medicaid, Medicare, and
Commercial
private insurance?
And
Okay.
all sources, private pay, even non-Medicaid.
Okay, private pay too would be included.
We have a sliding scale.
Okay, thanks. Thank you, Mr. Chairman.
Thank you. Ms. Peto?
Last line of the legislation text form says first year of the contract is not to exceed, it looks like the total amount. Is that some sort of a disclaimer in case the 3-year request is
The contract
expended in the first year or something? I'm not sure what that means.
Yeah, where are you seeing that, please?
It's the last line in the document that says request for legislation text, request for legislative action. It's under description of the request.
It's in the RLA form 6288.
Oh, in the letter?
Yeah.
Oh, I'm sorry. That is no secret language. That is just the amount that we believe we will need in the year, and we don't anticipate having this being an open blank check, and so that's the limit for the year.
For the first year, but that's a total of the 3 years, right?
No, that's just, the first year is that, and then the second year is a 0 raise, and the third year is a 3% increase. But that $1.9 million is for the 7 doctors and nurses for the 175 hours a week of service.
For 2025, 2026.
2025,
All right, then. Thank you.
with a hopeful 70% reimbursement.
And all included in the budget already.
Yes.
Perfect, thank you.
We have, Mr. Miller?
Motion to approve.
Do we have any other questions from the committee? Hearing none, we do have a motion from Mr. Miller. Do we have a second? By Ms. Lockhart, all in favor?
Aye.
Any opposed? Unanimous. Number 5, amending the 2025 Department of Mental Health Budget, Justice and Mental Health Collaboration Program grant funding.
Yeah, thank you very much. So I will just tell you all that the next 4 have a common theme. And you've heard me talk, I think, in the past about one of our main missions at the Department of Mental Health is to reduce the disproportionate representation of mentally ill folks in the criminal justice system. So each of these next 4 have that common thread. So this is, I was actually here last year, late in the year, talking about this grant. It is a 3-year grant, and we're looking in 2025 for a budget amendment to move funds from fee-for-service into a health home care manager line. And you may recall that when I brought this grant last year, one of the beauties of this is that we are partnering with our county probation department, and we're hoping that the care manager will work with the probation department to help folks who are coming out of our correctional facility to reintegrate into our community and to get their mental health needs addressed. What we've been trying to do for quite some time is to recreate our reentry project, which is with state prison people returning, recreating that with our jail population, and this is one element of doing that. So it's 97,158, that's salary and fringe for a health home care manager.
Thank you, Dr. Giordano. Ms. McLaughlin?
Thank you. So the common theme then is rehabilitation into the community.
Reentry
You just-
and reemployment.
reentry, and you just have 3 different locations or 3 different programs that you're directing all this funding, because you said the 3, 4, and 5.
They're separate and
really.
distinct, but there's a common thread to them. So the next 3 don't have anything directly related to this, except that they're all focused on that same mission.
Now, is there particular regions that are targeted, or is it throughout the county?
Well, in this instance, with our jail reentry initiative, it's folks that are incarcerated in our correctional facility who have mental health needs. And that number has increased pretty dramatically in recent years. We have over 250 people on our mental health tier in the correctional facility right now. And the challenge of treating them while they're in the jail and also helping them reintegrate into the community, that's really where we're hoping this position will help us. It's not always easy to know when they're going to be released or what that timetable is, but this position would be working with probation for folks that came in. And we have a shared caseload actually with probation, folks that are having mental health challenges.
So is it, I guess I'm trying to, what's that average, like, ratio that each caseworker would have? Like you said, you had over 200 people,
Right. Well,
and
so
how many of those per?
right. So in the jail, we have a full staffed clinic. And we have social work therapists and nurse practitioner prescribers. And I think those caseloads are pretty high.
Those, when they're fully staffed, it's about 40 or 50 people in the jail caseloads, but this particular caseload, because they're doing community work and transporting people places, might be a bit lower to really ensure that that quality care is occurring. But once they're linked to services, it would be fluid and new people would be coming on. But just to clarify, referrals wouldn't just come from probation. They really could be people with behavioral health issues who had connections to the criminal justice system that came to our attention that we could serve. But certainly probation is one of the biggest pieces of that.
Yeah, there's no shortage of folks coming out of our jail with mental health challenges.
And also, second and third year are going to bring on additional staff, which will be coming to you about in future years when those are coming on. At that point, we'll be able to expand and bring on more staff to serve more people with your approval, of course.
Thank you very much.
Yes.
Thank you. We have two questions. First, Ms. Lockhart, then we had our chairwoman, Joanne Cunningham. Ms.
Sure.
Lockhart?
Doctor, in it says that you're going to hire the care manager out of some leftover funds from that grant.
Yes.
My question is, where are you going to get the money to continue it? Is that
Well,
another
this
grant that
is
you're
a
applying
three-
for,
this is a
that you just
3-year
spoke about with the
Well,
bringing more people on?
this is a 3-year grant,
Oh, okay.
so that will get us 3 years down the road.
This one here is a 3-year grant?
Yes.
Okay. Okay.
With any project that we initiate that's grant funded, the sustainability question is always a challenge. And sometimes we could leverage that into other grants, sometimes we could make the case that it's worth it for the county to take that on. But,
So I assume that's the same situation for the peer advocate later, with that
Yes.
other one? Okay.
yes, yes.
All right, great, thank you.
Thank you. So mine was sort of the same. So this is a 3-year grant, so you're reallocating that, hiring this case manager for the entirety into 27 of this grant, of the lifetime of this
Yes.
grant. And
But we
is
just-
that,
oh, I'm sorry.
oh, no, that's okay. And is the case manager actually located at the jail in that clinic or else?
This person will be working in the community.
Okay.
We have something coming up very shortly in the jail. That's the common theme.
And sorry to cut you off before. Is there another point?
Thank you.
Okay, we're good. Thanks.
Do we have any other questions from the committee? Hearing none, can we get a motion to move? Motion made by Mr. Miller, second by Ms. McLaughlin. All in favor?
Aye.
Any opposed? Unanimous. Number 6, amending the 2025 Department of Mental Health budget, reentry services.
Right, so in the spirit of continuing the theme, this is something many of you have heard me talk about and you have asked many questions about. We're one of 20 counties in the state that has a reentry task force. And this is a renewal of our grant for $411,230. And we're looking to reallocate 23,000 of those dollars. Actually, I was here last in October where you approved the receipt of the grant. We're looking now to reallocate some money into fees for services to address the needs of some of these returning citizens that we didn't fully anticipate before. We'd like to move funds from, I think there's media and travel,
Yeah, it's printing and advertising and travel.
yeah, into fees for services and clothing allowance. What we're finding is that some of these folks who are state prison releases have not been amongst their community for many years. They don't know how to use a cell phone. They need an ID. They need help with their first month's rent. They, furnish all kinds of soft landing assistance. And what we're hoping to do is, what we're asking you is to be able to reallocate money in that grant into a fee-for-service line that we could then meet those needs as they come up.
Thank you, Doctor. Do we have any questions from the committee? Hearing none, can we get a motion to move? Motion made by Mr. Miller, second by Ms. Petto. All in favor?
Aye.
Any opposed? Unanimous. And number 7, amending the 2025 Department of Mental Health budget, jail diversion funding.
Right. So this is a similar request to make a budget amendment for a grant that you've already decided on. We'd like to reallocate grant funds to allow, in this case, we're moving it from fees for services to positions, to mental health assistants. These folks would be actually in our jail, working with folks, getting ready for their discharge, hooking them up to the services that they might need in the community. So this is the bookend to the first grant that we're talking about.
Thank you. Do we have any questions from the committee? Hearing none, can we get a motion to move? Motion by Mr. Miller, second by Ms. Petto. All in favor?
Aye.
Any opposed? And lastly, number 8, amending the 2025 Department of Mental Health budget, mental health court navigation.
Yeah, this is the last one, and we're very happy to come to you with this. The New York State Office of Mental Health has awarded us 100% state aid in the amount of $222,142 to hire 2 additional case managers to put on our mental health court team. And as you know, we launched our mental health court after many years of development. A year and a half, 2 years ago, we have 21 active cases right now. 12 people have graduated, and this is out of Judge Riley's court in the city of Albany. And what we're confident that these 2 new staff members will allow us to do is to double the caseloads. So we're hoping to move that 21 active cases to around 40. You know, these are high-intensity cases. They last anywhere from 9 months to 12 months as part of their court responsibilities is to follow treatment plans in the community. These folks would allow us to increase the scope of that effort.
Thank you. Do we have Ms. Lockhart?
Sure, the mental health court.
Yes.
So these people are diverted from the criminal court to the mental health court, thus keeping them out of the criminal justice system.
No, these folks are they're in front of Judge Riley in police court.
In police court.
And they're either their defense attorneys or the district attorneys have identified them as potentially benefiting from mental health court.
Right.
It's not diversion before they get there, but
Okay.
the hope is that this will divert them from incarceration if they can satisfy the demands of the court. It's similar in a broad sense to the drug courts that are out there.
Yeah,
But it's part of, they're sentenced to court,
gotcha.
and they have to complete their contractual agreement with the court. And if they're successful, I think they will drop the charge.
Their charge gets reduced to something fairly minor if they complete the course of mental health court.
But what types of crimes get put into mental health?
Yeah.
Obviously, they have to have a mental health issue.
Yeah.
But what would be
Yeah.
types of crimes that make them eligible
Well,
for that?
again, I mentioned that this took a number of years to develop, and there was a lot of concerns from all the different parties about this issue. What we initially started with was nonviolent, lower-level misdemeanor crimes. And the hope was that folks with mental illness who were kind of like cycling through the system would finally get the help they needed and not be recidivistic in that regard. The court has expanded a bit. There are some low-level felonies that have been, right?
Yes,
Yeah.
still non-violent.
Right, nonviolent, and it's tricky because there's only a certain amount that the court can do. They've set on 20 cases, 21 cases now, but there's a waiting list. You know, the public defenders identified people they'd like to come in. Perhaps the district attorney ultimately has to approve the cases that are admitted into the mental health court. And just for your knowledge, we thought that mental health court was potentially not the right way to call. We call this alternative treatment court. We thought that if the bailiff comes in and says, all rise from mental health court, or who's in mental health court, it's just stigmatizing. So this is really, in our world, it's called alternative treatment court. But it essentially is a mental health doctor.
So when they complete their obligation to the alternative treatment court,
Yes, thank you.
there's a case that, eligible for an ACOD or dismissal in criminal court, is that how?
The charge gets reduced to something minor, it's essentially satisfied, and then unless they get a new charge, they're done, basically.
Good, okay.
Yeah,
There is a graduation
yes.
ceremony for these folks. Deputy Director Hoffman has gone to many of them. I've gone to a few and spoken. It'll bring a tear to your eye.
Well, the drug courts have been successful, but I imagine the alternative treatment court has other challenges that make it much
But
better.
it's opportunities that these folks have not had before, and those that take advantage of it, and because it's voluntary,
Yeah.
and are successful. Some folks really, their
Some of
lives,
them are quite profound.
yeah, pretty, we hope not to see them again in court.
Thank you.
That covered?
Yes.
I just was, is it the case that their sentences or reduced sentences are tied to their continuation in the program?
Yeah, they have to finish they
Yes.
actually sign a contract, and
Yes.
it's usually 9 to 12 months. And
If they're not successful, they will end up having to face the charge that they were originally charged with. But that said, there's some leniency, that doesn't always happen right away. They're given many opportunities because there's an understanding these are high-risk folks with behavioral health issues. So it's not as if they're not immediately successful that will happen. They're given many opportunities.
And then there's a difference with drug court where, you may have heard sometimes people will relapse multiple times, the judge will put them in jail for a night. That doesn't happen with the folks on this case. So if these are folks with, compromised mental health conditions. And Judge Riley is really wonderful with these folks. And they respond by and large.
Thank you, Doctor. Do we have any other questions from the committee?
Anything else, everybody? No.
Stuff. Motion to approve. No questions? We have a motion from Mr. Miller. Do we have a second? By Mr. Collins. All in favor?
Aye.
Any opposed? Unanimous. Thank you all.
Appreciate it very much.
Thank you.
Good night. You get a motion to adjourn by Mr. Miller, second by Ms.
It's funny, I really like